We start this chair with Professor Zhongwei Yu. Thank you. He joined Nanjing Tech University in 2017 from Sichuan University. Also is a distinguished guest professor at the Chinese Academy of Sciences. He graduated from Peking University in 1981, served as senior visiting scholar in the Research Triangle Institute, RTP, and the University of Utah, respectively from 86 and 91 to 93. He was promoted as full professor in 1994 and a fellow of International Biomaterial Science and Engineering, FBSE, in 2004. He has received the Distinguished Visiting Fellowship Award of the Royal Academy of Engineering, won the first award in natural science by China Ministry of Education, and a recommendation for important contribution in the national medium and long-term science and technology development planning strategy research. He has also been elected as Vice Chairman and Secretary General of Chinese Committee for Biomaterials, Vice President of Chinese Society for Biomaterials, and Executive Member of the Council of the Chinese Materials Research Society, Chinese Society for Biomedical Engineering, Chinese Society for Biomaterials, and Director of Biomedical Polymer Branch of Chinese Society for Biomaterials, President of Sichuan Society for Biomedical Engineering. And I promise this is the short version of his CV.
Too long.
His research activities have been focused on molecular design and precision preparation of novel biomedical polymers, self-assembled biomaterials and nanobiomaterials, bioinspired and biometric systems for drug gene delivery, and molecular diagnosis biomaterials for tissue engineering and regenerative medicine and 3D bioprinting. Professor, the floor is yours.
Okay. Thanks, Chia, for your introduction, and also thanks conference organization, and also the, Professor Cui. Today, I just talked to you about molecule and supramolecular engineering of dendritic peptide for Bioinspired Nanoplatform. So with increased incidence and mortality, cancer in the leading causes of death in China, and is also a major public health problem since 2010. There are a lot of biological barriers, include extracellular barrier and also the intracellular barrier. Particularly for penetration in cancer, that is a big problem because their tumor transport is a diffusion limited process, abnormal vasculature and also density ECM, and also the fluid pressure. So another big problem is multi-drug resistant, that is MDI. From the clinical result, about 95% of cancer patients had failed clinical chemotherapy by MDI. The MDI is the main major challenge for successful chemotherapy. In my group, we just use targeting the mitochondria and interdicting DNA repair in tumor cell, and also overcome drug resistant associated cell factor, and also inducing tumor autophagy with a stereo-specific Dendritic protein nanomimics. And there are about 3 different kinds of nanocarrier in the drug delivery system. The first is liposome, based is since 1960. Another is a macromolecule from 1976. And another one is Dendritic. That is very special. So that is a new macromolecular architecture is in the polymer. And they are terminal grouper and initial core terminal grouper, and also the mono repeated unit we call the generation. So here just show you the dynamic model. And in my group, first synthesize high generation organoid graphite license dendritic in the high yield by click chemistry. And dendritic is a nanoscale dimension and mono display and contained. Also is a polyvalent and amplification of a function and control functionalization of the surface. And the peptide dendritic, that means is a contain amino acid bond. And so they is good biocompatibility, immunocompatibility, particular global protein. So there is a new generation biomaterial for imaging problem, non-viral vector, controlled drug delivery system, and also nano drug immunogen. And we make a bio-inspired multifunctional dendritic system as an efficient nano platform. So we have make a very precision synthesis and also the multi-functionalization and polymerization. Today I just want to talk to you about some how to reverse the MDI and also the make deep penetration in the cancer. Here to show you the capside is a mimetic supramolecular dendritic peptide system for enhancing tumor penetration. So here we just make a very special capsule like a nanocarrier. From here we can get the TM, and also from fluorescence imaging, then we can find we make the multi-cell spheroid, so we can find a very deep penetration here. And another one we make the product. That's one product, and so in the special cancer environment, the MMP is increased, so the PG will be shared and much better for cell uptake, and then also is a high concentration of GSH will destroy the nanoparticle. So the LND will be released and backward 2 will be decreased, and also caspase-3 will be increased. That is much better for apoptosis. And here you also can find the HK will decrease it. So that means is stopping the ATP driven MDI transport. So here just show you that is a multicellular tumor spheroid. It's got a very deep penetration. And here is the in vivo drug distribution. So now I just show you the new design for a wire-like member breaking a nanoparticle that with tumor activate and the cell and the tissue dual penetration. It's very important to have to choose which kind of amino acids much better to design this system. So you look at here is a histidine, and lysine, and arginine. That is a positive charge as an amino acid. So before we make the arginine functionalization peptide dendritic vector for efficient gene transfection. And also we use a different amino acid to modify the cytosine, So we find the arginine modifier is much better because in the gene transfection is about 1,000-fold difference is before before modification in the vitro. Or in the vivo also you can find about 150-fold when compared PI 2000. So that is another example we make is peptide dendrimer, and we assemble on the quantum dot, QD quantum dot, and then we find in vitro find the 50,000-fold is different gene transfection, and also is a very high gene transfection in the vivo. So now we designed the arginine-rich dendrimer peptide product, and also protect the positive charge, use a DA. And also here we use hydrogen bond to connect the doxorubicin. And then we get that is assembled, and in the tumor specific we'll activate. So we can find is a CD spectrum and the second structure, and also the drug will be released at the low pH. So here we use the top is a water buffer, and bottom is a chloroform and contain 1% of this compound. We just want to check that you can find in the pH 65, the compound will be transferred to interface between chloroform and water. And then we use the human red blood to just check that in the low pH, about 65. So the blood, the red blood, it will destroy, and so we can find the in the concentration is hemolysis concentration is much different, is high. And also we can find from the tumor, we use human drug-resistant human ovular cell. Then we can find that in the pH 7.4 is a excellent spread intact membranes. But when the pH decreases to 60.5, then we can find the morphology and is destroyed. So just like is a sponge structure. And also we can find the lactate LDH will be released from the cell inside, will release out. And here's just to show you the internalization and the penetration. So, and we find that that compound is independent of the specific endosome phase, but the other way is we can find that it depends the endocytes. And here we just use two different transfer model. Now here, this one just want to know that that nanoparticle will block through member barrier of the monolayer endocell cell and penetration into the tumor cell. Here's and also is a efficient transfer from one tumor cell to another tumor cell. Here just show you the deep tumor penetration. So we make the it's a sphere tumor cell, and also we can find that in vivo, and that nanoparticle can pass through the endothelial cell, and also the extra from the vessel. So now we just check the in vitro anti-tumor activity. Then we find that IC50 the nanoparticle is very low in the pH 65. If the pH 74, they'll be very high. So in vivo anti-tumor effect, we can find that is for nanoparticle is much better than the free drug, and also the other compare. So now I just talked to you about how to transfer dendritic from nanocarrier to biological activate. So here I just gave you two different examples. The one is we make a dendritic with tryptophan rich on the surface. So that is a first dendritic peptide is in the cancer chemotherapy. So another one is we just make a bioinspired design of stereo specific deep protein nano mimics for high efficiency autophagy induction. So we just make the stereo specific deep protein nano mimics for high efficient autophagy induce. So that is the D dendrimer and L dendrimer. So here from the ORD curve, then we can will be alpha value will be increased with the value increase, and also from CD spectrum, then it's very show the second structure, and also that purification is very nice, about 99%. So here we just use an autophagy probe to investigate the possible and the degrees of the nanoparticle in the Hepg2 line. So from here, this is rapamycin in the clinical use. So that is the D protein is much better than the clinical agent. And also we can check the cell ultrastructure analysis and can find the D for DPN and a lot of the autolysozyme and autophagocyte. And another way have to check the molecular biology evidence. So we compare the much larger amount of LC3 protein was expressed after incubator with D protein. compare the L protein. So here's a in vivo test of also we can show West protein, the D protein, the efficient upregulated LC3 protein. So now we want to check the autophagy mechanism. So we make the FITC fluorescence extinguish when FTITC nanoparticle also decrease with the BHQ. So when compare the L protein and D protein, then we can find the L protein will be get the fluorescence here, but the D protein is much stable. Then we find that D protein always offers a much high autophagy introduction efficient than L protein, the different cell line. So here we just look, if we only use that D or L protein, that's no cytotoxicity. And then we use doxorubicin and plus the D or L D protein, then we can find the cytotoxicity is much higher than that one. Okay, I'd like to thank my student and also the working professor some work with me, and also for foundation and cooperating. Thank you very much.